We know that diabetes is becoming very prevalent in the world, and so many people have diabetes. In fact, 1 out of 3 people have either pre-diabetes or diabetes in the United States. So if we were 3 people in the room, one of us would likely have pre-diabetes or diabetes. You want to know the signs and symptoms of diabetes in case you start to develop these symptoms. You can take charge and you can get the proper care that you need right away before it's too late and before you become very sick. Before we talk about the most common signs of diabetes, if you are new, please consider subscribing to my channel, share this video with others, and as always, comment below and let me know if you had any symptoms prior to your diagnosis of diabetes. Number one is excessive urination. So we know our bodies are meant to work for us. Believe it or not, our body's always trying to fight all day long, trying to keep things in stable range. When our blood sugar levels are spiking in our bloodstream, the body tries to get rid of it, and that's why we urinate excessively. Even if everything that we're drinking, everything that we're doing, we normally will urinate it out because our body is trying to really get rid of it and to keep our glucose levels in a normal range. Another one is if you're very thirsty, because we know that sugar can dehydrate us. So if our sugar levels are becoming too elevated, it tends to dry us out. For that reason, you're very thirsty all day long, and it's unusual amount of thirst that you have. If you're having excessive urination and you're feeling very thirsty, it is something that maybe should warrant a doctor phone call to ask them maybe to screen you. The next one surprises a lot of people. So if you're losing a lot of weight unintentionally, a lot of people think that diabetes is you actually gaining weight, you're overeating. That's actually not true. If our blood sugars become very elevated or significantly high, we start to lose weight. And the reason why we lose weight is because our body is not getting any of the glucose inside the cells. So our cell is actually starving because there's no insulin or key to open up the cell so the glucose can go there for energy. Instead, the glucose stays in our bloodstream and our cells are starving. For that reason, we will lose rapid weight loss. I have had scenarios where patients have lost 40 pounds within like 6 to 8 weeks, and they had no idea what was going on with them. Another sign is you're very hungry. Again, your cells are starving. So you're trying to eat, but you're still losing weight because that food is actually not being processed the way it should, and it's not going where it should go, which is inside the cell. If you're having blurry vision, that's also an alarming sign. Unfortunately, we know that high blood sugars affect our vision directly. The vessels that feed our eyes are very narrow, therefore glucose affects those vessels and can cause swelling behind our eye. For that reason, our vision will become blurry. And just note, if you are getting treated, your vision can be blurry for quite some time, weeks. So we normally recommend that once I see a patient and I start managing their blood sugar levels, I tell them that they can expect to have that blurry vision on and off for quite some time. So therefore, I tell them to hold off on having an eye exam for at least 2 to 3 months, sometimes more, until blood sugar levels are completely stabilized. High blood sugar can also affect our nerves that feed our peripherals. So that's why you may notice some numbness and tingling. For that reason, if you are noticing something unusual, you definitely want to get it checked out. Very tired, of course, when we have blood sugar levels. I always tell patients when our sugars and our diabetes is out of control, it's like an elephant on top of us. When we start to manage our blood sugar levels, it's like we take the elephant off our backs and now we feel more lighter, we feel more energetic. So feeling tired is correlated with poorly controlled blood sugar levels and a sign that your blood sugar levels may be higher than they should. Therefore, the possibility of diabetes exists. Very dry skin. Again, I know, high blood sugar can make our skin very dry because it can dehydrate us internally, and our bodies are just very dehydrated. And there's a lot of other skin conditions that are correlated with pre-diabetes and diabetes. So be sure to check that video out too, because our skin can tell us a lot about a lot of different conditions, including diabetes. So if you have sores and they're healing very slowly, we know that having high blood sugar levels or having diabetes makes healing process much slower. So healing slower than you usually do, that's also a warning sign and a possibility of diabetes. And if you're having a lot of infections, believe it or not, a lot of times we diagnose patients with diabetes because they're getting boils under their armpits and other private areas. and they will go to the doctors and say, I keep getting these recurrent boils or infections. And that's how they will get diagnosed with diabetes. And then, of course, they are usually referred to an endocrinologist or managed by the primary care. But the point is, all of these can be early signs of diabetes. So if you have any of these, please be sure at least call your family doctor and let them know so they can run a test to see if you may have diabetes. Other factors may be if you are overweight or obese, if you have a family history of diabetes, all of those and these signs, you are a higher risk that you could have diabetes. For that reason, make sure to be checked out because you always want to start treatment and know as soon as you can so you can start your proper regimen. Until I see you next time, please stay healthy and happy. I will see you all on the next video.